So the pathogenesis of Dipylidium caninum infection in dog and other animals. So before starting the pathogenesis, we may have a look at video first. So what you can see, one of the gravid proglottids is coming out by crawling, and this is the perineal region. Often you can see some of the gravid proglottid are stick to this area, and so just changing the pointer. So the adult parasite shares gravid segments. You know that these gravid segments can be either passed out through the feces or they may crawl to the perineal region. Due to this crawling on the perineal region or perineal or anal region, this actually produce a very unpleasant discomfort. To get rid of this unpleasant discomfort, dog try to drag their anus to the floor or try to bite their anal region. As a result, there should be some injury to the anal region or tail region, and some of the clinical signs are produced, and we are going to talk about those clinical signs in a minute. So the clinical sign during Dipylidium caninum infection in animals and men. I have already mentioned that the adult parasites are less harmful and they can be tolerated. Maybe the hundreds of parasites can be tolerated without producing any clinical sign. But in case of heavy infection in young animal, that is in puppies, some non-specific abdominal symptoms can be found. They are constipation, diarrhea, pot-bellied appearance. So what is pot-bellied appearance? So due to the huge load of parasite in the intestine of the final host, the entire abdomen get protruded. So that is called pot-bellied appearance. And other clinical signs include abdominal pain, unthriftiness, dragging of anus, and hair loss from the perineum and tail region. In man, the common clinical sign includes perineal itching, diarrhea, and abdominal pain. So the diagnosis of Dipylidium caninum infection, as usual, you should go for checking the clinical history and clinical sign or findings that I have already mentioned. But one of the major things you can consider while diagnosis of this parasitic infection is the presence of gravid segments or gravid proglottid on the feces or perineum. You can see a lot of gravid proglottid on feces, and another in this picture you can see a gravid proglottid is on the perineum. And just wait for a moment, we will play another video so you can see a lot of gravid proglottid on the feces and they are moving. And then you should go for laboratory examination. So the sample that are sent to the laboratory, you should go for the gross examination of the feces just to check the presence or absence of the gravid proglottid with the samples. And if you get one or two, you should first check the morphology that I have mentioned earlier. The mature segment or the gravid segment is like a rice grain or cucumber seed or pumpkin seed. That would be all right. And if you have further, you can check the genital organs or the presence of how many pores, genital pores on either side of the proglottid. That also help you to identify that this gravid segment from Dipylidium caninum, not from other parasite. And then with the feces you can go for coproscopy, that is examination of the fecal samples followed by examination of those smears under the microscope. And what you can see the egg packets or egg sacs or egg capsule that will contain around 20 eggs in each of the egg capsule or egg packets, and that is the confirmatory diagnosis of this parasitic infection. So these are the reference books that I have used um, during preparing this presentation, and I have also used some video and internet material, images from internet. And thank you all for watching this video.